That weed crushing up through the crack in your sidewalk isn't a nuisance. It's one of the most studied medicinal plants in human history, and there's a reasonable chance it's growing within 50 feet of where you're standing right now. The strange part isn't that it heals. The strange part is that you've never been told. Over the next 10 minutes, you're going to meet 7 so-called weeds that mainstream medicine quietly forgot, each one backed by peer-reviewed research. Each one growing in lawns, vacant lots, and roadside ditches across 6 continents. And by the end, you'll understand exactly why the most powerful pharmacy on Earth isn't behind a counter. It's under your shoes. Let's start with the plant Native Americans called white man's footprint. Common plantain, Plantago major, followed European settlers everywhere they walked, sprouting in compacted soil, trail edges, and the seams between paving stones. You have stepped over it 1,000 times without knowing. Look for a low rosette of broad oval leaves with parallel veins running cleanly from base to tip, like green ribs on a pale spine. Those leaves are loaded with allantoin, aucubin, mucilage, and flavonoids, compounds with documented antimicrobial and tissue-regenerating activity. A 2022 study published in the Journal of Traditional and Complementary Medicine reported accelerated wound healing in hyperglycemic diabetic rats treated with plantain, including faster epithelialization and reduced inflammation. In the field, the old trick still works. Crush a clean leaf between your fingers until it weeps green juice, press it against a bee sting or mosquito bite, and within minutes, the itching subsides. Folk healers also brewed it for sore throats and digestive upset because the soluble fiber inside the leaf behaves a lot like psyllium. But plantain is only the introduction. The next plant is one you have probably already declared war on. Dandelion, Taraxacum officinale, the cheerful yellow flower that every suburban homeowner sprays into oblivion every spring. Here's the irony that should rearrange the way you look at your lawn. In 2009, a human clinical trial by Clare and colleagues confirmed that dandelion leaf extract produces a real, measurable diuretic effect, increasing urinary frequency within hours of consumption. Not folk belief. Hard data. Root extract has also been shown to protect the liver in animal models of acute on chronic liver failure, lowering AST, ALT, ALP, and bilirubin levels. The active compound taraxasterol quietly turns down inflammatory pathways at the cellular level, and the leaves themselves are nutritional powerhouses, dense with vitamin A, vitamin C, vitamin K, iron, and potassium. That bitter taste you spit out as a kid is exactly what makes it work. Bitter compounds stimulate digestive enzyme production, which is why European apothecaries prescribed dandelion tonics for centuries before anyone thought to call it a weed. You've been mowing medicine and paying for it, but the next plant might be the most nutrient-dense leaf you've never eaten. Meet purslane, Portulaca oleracea, low-growing, succulent with thick fleshy leaves and reddish stems that creep through garden beds and sidewalk gaps. The World Health Organization lists it among the most widely used medicinal plants on the entire planet, and yet most Americans yank it out and toss it in the compost. Purslane is the highest plant source of omega-3 ALA of any leafy green, with roughly 5 times more than spinach. 5 times. Vitamin A levels measured in purslane are 10 to 13 times higher than in tomatoes or broccoli. And in 2024, a randomized double-blind clinical trial reported that 8 weeks of purslane supplementation reduced liver stiffness, lowered liver enzymes, decreased blood glucose, and reduced inflammatory markers in patients with fatty liver disease. Mexican, Greek, Turkish, and Indian cooks have used purslane for thousands of years. They eat it raw in salads, stir it into stews, and pickle it for winter. Somewhere along the way, the rest of us forgot. Now, before we get to the plant that actually fights you back, ask yourself this. If a leaf this powerful grows free in a vacant lot, what does that say about the supplements aisle? Hold that thought. Weed number 4 is the one that stings. Stinging nettle, Urtica dioica, tall and serrated, covered in tiny hairs that inject formic acid into anything that brushes against them. You have felt the burn. You have cursed the plant. But here is what almost no one tells you. A 2013 double-blind randomized trial with 100 patients found that nettle roots significantly reduced the International Prostate Symptom Score, lowered PSA levels, and shrank prostate size in men with benign prostatic hyperplasia. An osteoarthritis trial reported WOMAC pain score improvements of roughly 30 points, compared to about 10 points for placebo. Nettle inhibits the histamine pathway, which is why it has been used clinically for seasonal allergies and hay fever. The leaves themselves are loaded with bioavailable iron, calcium, magnesium, and vitamin K. And the sting? Cooking or drying completely deactivates it. A few minutes in hot water, and you have a perfectly safe, deeply nourishing green that costs nothing and grows everywhere, from forest edges to disturbed soil along your back fence. Treat it like spinach, make it into soup, drink it as tea. The plant that hurts you on contact heals you when you treat it with a little respect. Now drop your eyes lower to the cool, damp corners of your lawn, the shaded edges of garden beds, the patch under the hose bib where the grass struggles. You are looking for chickweed, Stellaria media, a tiny mat-forming plant with small white star-shaped flowers. It is so common most people do not even register it. Chickweed contains saponins, flavonoids, and surprisingly high levels of vitamin C. Antioxidant water extracts of the plant score at the top of free radical scavenging assays. Topically, it acts as a demulcent, soothing eczema, itching, minor burns, and irritated skin when applied as a poultice or infused into a salve. Preclinical research has documented anti-obesity, anti-diabetic, and anti-inflammatory effects in animal studies. European herbalists used it as a cooling spring tonic and a remedy for respiratory congestion, and the name itself comes from the simple fact that chickens love it. You can eat it raw in a salad. It tastes faintly like corn silk, and it is probably under your back step right now. The next plant comes with a body count. Yarrow, Achillea millefolium, with feathery, fern-like leaves and flat-topped clusters of small white flowers, grows in meadows and along roadsides as if it owns the place. Its folk name is soldier's woundwort, and the use traces back to ancient Greek armies. The genus itself is named after Achilles, who according to legend packed yarrow into the wounds of his soldiers. Modern research is finally catching up to those battlefield medics. Rat model wound studies showed that 1% yarrow essential oil ointment accelerated healing, reduced inflammation, and killed Staphylococcus aureus and Pseudomonas bacteria outright. A 39-patient clinical trial on venous leg ulcers found that a 7.5% yarrow extract ointment outperformed saline dressings on epithelialization. Published phytomedicine research has documented vasoprotective activity from standardized extracts. And out in the field, the old practice still holds. Crush a few leaves, press them against a minor cut, and the bleeding slows. 3,000 years of soldiers can't all be wrong. The seventh plant is the one the bees visit. Red clover, Trifolium pratense, has pink-purple flower heads on those familiar three-leaflet stems scattered through fields, lawns, and roadside ditches. The same flower you picked apart as a child to taste the nectar at the base is rich in isoflavones, biochainin A, and formononetin, plant phytoestrogens that bind weakly to estrogen receptors. Meta-analyses have shown modest but real reductions in hot flashes for perimenopausal and postmenopausal women. Red clover has been studied for cardiovascular markers, including arterial stiffness and lipid profile improvements. Traditional use included respiratory conditions and as a lymphatic tonic. The flower that bees turn into honey is, in clinical terms, a research-grade medicinal plant. 7 plants, 7 studies. One uncomfortable question: why is this the first time you've heard most of this? Here's the catch I promised earlier, and it isn't conspiracy, it's economics. A plant in its whole form cannot be patented. Pharmaceutical companies have no financial incentive to fund expensive Phase 3 clinical trials on something anyone can grow in a flower pot. Many of the most important drugs in modern medicine were originally derived from plants. Aspirin came from willow bark. Metformin came from French lilac. Taxol came from the Pacific yew. The plants didn't vanish from medicine. The marketing money simply moved to the isolated, patentable compounds extracted from them. Research funding follows patents. Patents require ownership. Ownership requires control. And a plant that grows in a sidewalk crack cannot be controlled, cannot be sold for shareholder profits, cannot be marketed in a glossy commercial during the evening news. The result wasn't active suppression. It was something quieter and more efficient. A systematic forgetting. Economic systems only see what benefits economic systems, and a free plant is invisible to a balance sheet. The good news is that the forgetting is starting to reverse. Peer-reviewed research on these plants now appears regularly in journals including the Journal of Ethnopharmacology, Frontiers in Nutrition, Phytomedicine, and Antioxidants. Universities in India, Iran, Turkey, and Brazil are leading much of this work, and Western institutions are slowly catching up as plant-based therapeutics gain scientific credibility. The active compounds are real. The studies are real. The traditional uses, in many cases, are being validated by the same methods we use to evaluate pharmaceuticals. The plants never left. We just stopped looking at them. Before you wander off into your yard with a basket, a few honest warnings. Never forage from roadsides, lawns sprayed with herbicide, or industrial edges where lead and exhaust contaminate the soil. These plants supplement health. They do not replace prescribed medication. Check for drug interactions before use because dandelion interacts with diuretics, red clover with blood thinners, and nettle with blood pressure medications. If you are pregnant or breastfeeding, talk to a clinician first. Start with small amounts to test for individual sensitivities, and positive identification is non-negotiable. Use multiple field guides, cross-reference photos, or consult a knowledgeable forager before putting any wild plant in your mouth. That weed crushing up through the crack in your sidewalk really is one of the most studied medicinal plants in human history, and now you know its name and you know 6 of its relatives. The most interesting pharmacy on earth is not behind a counter. It's the strip of green along your driveway, the patch your mower keeps trimming, the so-called nuisance you've been pulling out by the roots for years. This week, walk slowly through your yard and see how many of the 7 you can find. Crush a plantain leaf. Taste a dandelion green. Notice the chickweed under the hose bib. You don't need to forage. You don't need to medicate. Just look. Because once you can see them, you can't unsee them, and the ground beneath your feet stops being a lawn and starts being a library.